Hello everyone. We extend a warm welcome as you join us for this medical podcast at MedSynapse. I am Dr. Harshita, your host, and I'm honored to have the privilege of introducing our esteemed guest, Dr. Sanchayan, a renowned medical oncologist. Doctor's profound knowledge, experience, and practical insights are poised to enrich our conversation today on the topic updates in head and neck cancer in India. Dr. Sanchayan is currently the medical oncologist at HCG Cancer Center, Kolkata, West Bengal. With over 15 years of experience in medical oncology, Doctor has honed expertise in hepatobiliary cancer, chemotherapy, immunotherapy, targeted therapy, and management of their toxicities. Doctor has keen interest in clinical trials and has been part of many international clinical trials as co-investigator and is also certified in professional diploma in clinical research. His contribution to medical research are a testament to his unwavering commitment to advancing knowledge in the field of oncology. We express our deep gratitude for having you with us, Dr. Sanjay.
Yeah, thank you, Ashita, for your nice and brief introduction. So yes, today is I want to talk about the very important topic, the head and neck cancer is a very prevalent in India, and I will definitely give some updates and my work, my experience I will share definitely with the audience.
Let's commence the interview session. Doctor, in your experience, what challenges do patients with head and neck cancer face these days in terms of assessing timely and comprehensive care?
Yeah, basically, Ashita, what I have seen in my clinical practice that the head and neck cancer being the number one leading cause above lung cancer in India. So it is the most common leading cause of cancer in men. In female, although it stays a little bit down, but in male, it is a number one cause. And head and neck cancer, apart from the risk factors that I have, I have my own YouTube channels where I can put my these educational videos. I like to aware the people about that taking and not taking of gutka, tobacco, or any form of smoking. It is the most common cause of head and neck cancer. Apart from this, also human papilloma virus is the important virus that is also play a good role in this oropharyngeal, hypopharyngeal, laryngeal cancer in head and neck cancer. Because head and neck cancer is a divided into many subparts. It is like oral cavity. If we go deep, is oropharynx. If we go more deep, is oropharynx, and in front of it is the larynx. So all constitutes head and neck cancer, and above oral cavity it consists of the nasal cavity, nasopharynx, and this maxilla, the ear sinuses. All this comes into the same part. The head and neck cancer is a very big anatomical landmark, starting from our air sinus till the larynx. So it is a big place where this insult occurred and it led to the cancer. And in my clinical situation, I have seen that most people come in very advanced stage of cancer. I rarely find the patients in very early stage of cancer. That is very rare person. Yes.
Okay, doctor. And are there any advancements in treatment options for head and neck cancer, like any novel therapies or targeted drugs that are being used?
Yeah, basically, Shihashita, I am actually well trained in my Gurgaon hospitals and Delhi hospitals. I am specialized in immunotherapy and targeted therapy. And with the advancement of the science in head and neck cancer, now I see the use of the targeted therapy and the immunotherapy. That is the latest addition in the head and neck cancer that is come up. And I have seen applying this targeted therapy and immunotherapy, I have seen very good response, dramatic improvement response, at least 40 to 60% cases,
Okay.
apart from
And
chemotherapy. Yeah.
okay, doctor. And how has the incorporation of molecular biomarkers and genetic testing in diagnosing process influence treatment decision and patient outcomes for head and neck cancer patients?
Yeah, basically, see, when we actually do the biopsy from the lesion, I actually personally see there is some treatment modality like localized form of treatment and systemic form of treatment. So localized form of treatment, be it a radiotherapy or surgery, take care by my surgical colleague or addition of colleague. Now, on my part, is when I play the role for the systemic therapy like chemotherapy, immunotherapy, targeted therapy, as you told, novel therapies. So I have seen that, yeah, when biopsy after biopsy, I put some markers in some inoperable, recurrent, or metastatic setting. I see the expression of the PDL1 or MSI. That is the marker of the immunotherapy. Okay. Apart from this, we can use targeted therapy because in head and neck cancer, it is a long back. It has been shown that there is a much EGFR particular targeted mutation is high in expression in case of advanced head and neck cancer. So you can use anti-EGFR targeted therapy in this case, apart from the chemotherapy.
Okay, doctor. And doctor, since you have been part of many clinical trials, are there any ongoing clinical trials or research studies in India related to craniofacial malignancy that you find particularly promising? Could you share some insights into these studies and their potential impact?
Yeah, basically, see, our medical oncology field actually continuously upbringing, and there is upliftment of the science. Continuously, there is new molecules are coming into the market. So there are actually lots of clinical trials are going in different institutes of India, be it our TMH Mumbai, be it our hospital Artemis Gurgaon, or big corporates, or with a good government hospital. So there are many phases of trials like phase 2 trial or phase 3 trial or post-marketing surveillance phase 4 trials are going on. And it has been continuous effort for the targeted therapy and immunotherapy. That is the most important come up in advancement. And there are many head-to-head trial or controlled study along with the base supportive care versus immunotherapy or targeted therapy, or along with the radiation therapy, targeted therapy, or immunotherapy in the advancement, or there is a new addition, immunotherapy plus oral metronomic therapy, because that is a latest TMH Mumbai trial has been done, that in case of India, where there is a cost issues is there for affordability of this high cost immunotherapy, they have tried for low dose immunotherapy along with the oral metronomic therapy in case of unresectable recurrent and metastatic head and neck cancer. And I have personally used in this type of therapy in my day-to-day practice, and I have seen there is a good response in this combination of therapy, cocktail regime.
Okay, doctor, and can you share any success stories or cases where innovative treatment approaches were used for such patients?
Yeah, basically, see, when actually our colleagues sent to me, give the referral for the systemic therapy for suppose this recurrent setting and metastatic setting. So every other department actually lifting their hand to help the patient. So at that time, it is my part to hold their hand. Now, in case of advanced head and neck cancer, they actually very aggressive type of malignancy, and they grow very fast. There is a rapid repopulation of the tumor cells if we give a good gap between the treatment also. And we have seen that in these cases, we have used this type of medications, and I have seen when there is a no involvement or in discovery of this targeted therapy, novel therapy, or immunotherapy, we have seen hardly the patient survive for 2 to 3 months. And I can see in my patients, be it a less number, I have seen that in such advanced malignancy, I have seen at least a good survival I am giving to the patient, at least for 6 to 8 months or 1 year. In some cases, there is more. Okay, so yes, it is a prolonging of survival and giving a better quality of life. That is my motto of my treatment practice.
Yes, doctor. Thank you, Dr. Sanchayan. We extend our sincere gratitude for your time and valuable insights you shared regarding the head and neck cancer today. With that, we come to the end of today's episode. We hope you found this discussion informative and insightful. Remember to stay connected with MedSynapse for the latest advancements and expert knowledge. We look forward to bringing you more enriching discussions in the future. Thank you and bye-bye.
Thank you. Thank you very much. Goodbye.